This is oral manifestations of systemic diseases. I'm actually going to divide this lecture into several parts. So this is part one of three parts, and we're going to focus in this section on the endocrine disorders. The sections that we're going to talk about are all different conditions that are actually systemic conditions, but all have an oral component, an oral sign or symptom associated with them, hence the oral manifestations. It may be changes to the mucosa, it may be changes to the bone, either the maxillary or the mandibular bone. So let's get started. We'll talk about these disorders that are associated with the endocrine system. So you know the endocrine system is a series of integrated glands and cells. They're all responsible for hormone secretion. Hormone secretion is controlled through some type of feedback mechanism in the bloodstream. So it controls whether we have too much or too little or just enough of the right hormone from the different endocrine gland. When we have a disease process going on, we either get too much or too little hormone production. Maybe the gland isn't working properly, so there's dysfunction of the gland. There could also be a problem with the control mechanism that's necessary for the production of the gland. So there's a number of different conditions or diseases that can occur as a result of one of these things happening. The first one of the conditions that we're going to talk about is hyperpituitarism. This is excess hormone production by the anterior pituitary gland. They believe it's caused by a pituitary adenoma. Now, this is a benign condition, that's the good news, but what it does is it increases the growth hormone production in the body, and that can occur at two different points in life. It can occur during development, so giantism is the term that's used. This is before long bone closure, hence during the period of time when development is occurring. And in individuals who have giantism, they have excessive growth of the overall skeleton. So they can be very tall, somewhere between 7 and 8 feet tall. They can weigh 700 pounds in weight. They're just very much larger than the average individual. A more rare condition of hyperpituitarism is acromegaly. Now, this occurs after development is completed. It typically is seen in adulthood, typically around the age of their 40s. It's a very slow, insidious onset, meaning it's a very slow growth type of condition. People generally experience headaches. They might report chronic fatigue, muscle or joint pain, all associated with this condition. Now, acromegaly is much more rare, and you do need to keep in mind that it occurs after long bone closure. Individuals who suffer from hyperpituitarism can have a number of different clinical manifestations: poor vision, a sensitivity to light, enlargement of the bones that impact the nasal bones, the maxilla, the mandible, and the forehead. They also may have a very deep voice. Their lips, the tissue may be thicker, and they may experience macroglossia, which is an enlarged tongue. It's diagnosed through measurement of growth hormone, and then pituitary gland surgery is typically the treatment that is recommended. This image is from your textbook. This is figure 9.1, and it shows macroglossia in a patient who has acromegaly. Hyperthyroidism is another condition that can occur. Hypothyroidism is caused by thyroid adenoma. Now, what you're seeing in the image on the screen is a picture of a hyperfunctioning thyroid. It's an enlarged thyroid, and if you notice, it's only on one side. So this would be something that you could evaluate and determine through your extraoral exam. Now, if you were looking at the image to the right with the neck and the enlarged area, that's a goiter. That's something that you typically want to pick up. But you should be able to start to feel these changes, and sometimes the patient feels them themselves as they palpate their neck or they're feeling their neck for one reason or another. There's a woman in the image because women are 10 times more likely than men to experience hyperthyroidism. The result is an excess amount of thyroid hormone being produced. They also call this condition thyrotoxicosis. This is excess production of thyroid hormone. The diagnosis is made most often when an individual hits their 30s or 40s and they're having typically routine blood work. So when they check your thyroid levels, what they may find is there's an excess production of thyroid hormone. The most likely cause in more than half of the individuals is Graves' disease, which is an autoimmune disorder. This causes an overproduction of thyroid-stimulating immunoglobulins. There are other conditions such as hyperplasia of the gland, maybe a benign or a malignant thyroid tumor, pituitary gland disease, or a metastatic tumor. What you see clinically with this individual is their complexion is really rosy, much brighter or colorful than you would expect. The palms may have some redness to them. They may sweat more than others. They may have a fine covering of hair, in addition to any other body hair that's present, or the texture may change. The nails are softened, so it's difficult for them to grow nails. They may have exophthalmos, which is the protrusion of the eyeballs. They may have anxiety levels, so you may want to address their appointment time to manage the stress related with anxiety as per dental treatment. They may not feel very strong. They may be restless. They may also have some heart conditions. Specifically in the mouth, we see premature tooth loss in the primary teeth, premature eruption of the permanent teeth, signs of osteoporosis, changes of the bone that you would see radiographically. They're at increased risk for caries, for perio, and they may report a burning tongue. The most common treatment that's used in adults with hyperthyroidism is radioactive iodine. The reverse condition, hypothyroidism, again, you see a woman pictured here, and the effects on the body are outlined in the graphic that I have to the right. But in hypothyroidism, there is less thyroid hormone being produced. Cretinism occurs during infancy and early childhood, and that is the name for hypothyroidism in that population. Myxedema occurs in older children and adults. Typically, the cause is a developmental disturbance, maybe an autoimmune disease, an iodine deficiency, although we see that pretty rare these days. Drugs, though, some medications, and pituitary disease are all contributing factors or causes to hypothyroidism. Clinically, we see thickened lips, macroglossia again, an enlarged tongue, possibly tooth eruption, and then that would be in children, and then an enlarged tongue or macroglossia in adults. There's a primary form and a secondary form of hypothyroidism. In primary hypothyroidism, the thyroid gland is abnormal. But in secondary hypothyroidism, the pituitary gland does not produce sufficient thyroid stimulating hormone, or what we call TSH. Doctor might have discussed that with you. So it's the opposite condition of hyperthyroidism. Treatment includes thyroid hormone replacement therapy. We know that because a lot of patients are taking Synthroid or levothyroxine. That's a common medication that's used to treat hypothyroidism. Moving on, we're going to talk about the parathyroid, and the first of those is the hyperparathyroidism, which is excessive secretion of parathyroid hormone, or PTH. The focus of parathyroid is to break down or use effectively the calcium and phosphorus in our diet or that we intake. When we have hypercalcemia, we have increased calcium levels, and hypophosphatemia is a decreased phosphorus level. There are four parathyroid glands. They're all located near the thyroid, so this is again something that you would evaluate during the extraoral exam. And calcium is obtained mainly from our diet products, from dairy, and it's important in contraction of different types of muscles. So being able to effectively use the muscles is something that may be a sign or symptom associated with hyperparathyroidism. Then there's a primary form where again the parathyroid is abnormal with maybe some hyperplasia, and then there's the parathyroid is producing insufficient TSH. So we have a secondary form as well. Clinically, we see it most often in middle-aged adults and mostly women. The function of the parathyroid is to maintain normal blood levels of calcium through its effects on the uptake of dietary calcium from the GI tract and to move the calcium from bone to circulating blood. So if there's a digestive issue and you're unable to absorb calcium from the GI as part of the digestion, then that would be a secondary hyperparathyroid condition. Individuals with hyperparathyroidism can suffer from joint pain and stiffness. They may have kidney problems because of the imbalance of the calcium and the phosphorus, skeletal changes, GI system problems. They may be tired. They, in extreme cases, go into a coma. Orally, we either see on a radiograph very well defined unilocular, like one lobe, or multilocular, multiple radiolucencies. The teeth may have the bone may have a mottled appearance to it. You may see a partial loss of the lamina dura as you investigate the radiographs, and the teeth themselves may be loose. All of these are things that can be identified during a routine dental visit. The differential diagnosis, and something that requires referral in order to be ruled out, is we want to determine that the patient does not have a central giant cell granuloma. So it is important that referral occurs. Diagnosis is made through measurement of parathyroid hormone blood levels and through evaluation of serum calcium and phosphorus levels in the body. Whatever the cause of this increased hormone production is, we want to correct that. So if it's a tumor, remove it. If it's renal or kidney disease, we want to make sure that that gets addressed. Maybe something as more drastic as dialysis. And then if it's vitamin D deficiency, increasing the amount of vitamin D in the diet. So here on the image on the slide, you can see the radiolucencies that are occurring in the bone. If you evaluated the mobility of the teeth, you would find that the teeth are looser. There's mobility there that you would need to chart. That loss of lamina dura, it's a little harder to see here, but you can again see the radiolucencies. They call this appearance to the bone, and this is one of those classic features that I've talked to you about before, is ground glass appearance. Microscopically, the lesion looks very similar to a giant cell granuloma, and this is why evaluation is necessary. So these are images that you can see again in your textbook. So let's call it, this is our break 1. We'll move on to diabetes in the second video, but right now, this is the first portion of the oral manifestations of systemic diseases.